defending mediocrity in our profession. I've spent the last few weeks kind of beating up on the PT profession, giving it the business a little bit, and I wanted to switch gears for a week or two and talk about something else, talk about something that was more patient-centered, more clinician training centered, something that all of us can sink our teeth in onto and learn a little bit and get a little bit better. And what I wanted to talk about today was some of the big metaphors I like to use. I'm a huge fan of metaphors. I'm a huge fan of getting patients to understand why I'm doing the things that I'm doing and why they're doing the things that I want them to do and what their role is as a patient. So if you're a patient, this is a good thing to listen to. If you're a therapist, maybe you'll pick something up, a little different way of explaining things. We all know in the PT profession that patient understanding improves compliance. If they understand why you're looking at something, why you're doing something, why you're trying to diagnose something that's not at the area that they're pointing at, then they're much more likely to either do the home exercise program or be invested. And invested is a really important thing because when patients are invested, they do better. They have better outcomes. They're either more compliant. There's always a placebo effect in terms of every treatment that you ever do. There's always a placebo effect. So if they're bought into what you're doing, if they have an understanding of the why and it makes sense to them, then they're going to have better outcomes. Unfortunately, just like when a mechanic talks to me about my car, I have no idea what the mechanic's talking about if they start using mechanics lingo. I have no idea what these items are in the vehicle. I have no idea how they work together. So the mechanic has to use a little different way of explaining it to me, just like we have to do a little different way of explaining to our patients. If I go into medical lingo with an overwhelming majority of my patients, it's not going to work. I'll understand it, it'll make sense to me, but the patient will eventually just start nodding their head and saying yes, even though they have no idea what you're talking about. So that's a big reason I love to use metaphors. Metaphors, to me, a great way of getting them to understand a couple of different things about treatment. So I'm going to not just go over the metaphor and say, here's the metaphor and here's why I use it. I'm going to go over sort of how it influences my patient care or why I pick these metaphors because of the way I do patient care. One of the big things in my business that I do, and one of the reasons that I get so many different outcomes from other therapists in the area, I mean, a lot of my patients are, because I'm direct access private pay, they've seen 2 or 3 other PTs and 2 or 3 other chiros. So if they come to see me and I do the same exact stuff that everybody else was doing, they're not going to get better, and it's going to be a waste of everybody's time and money. So I approach things a lot differently. I treat the body as a whole, which is one thing that I've been banging on my entire podcast. Always look at the body as a whole. I believe strongly in the idea of regional interdependence, which essentially says regional interdependence basically means that one area of the body that it does not have an anatomical connection, meaning there's no muscle, there's no tendon, there's no ligament or anything attaching those 2 areas, has a great influence on a different area of the body, even though they're not anatomically connected. So you hear it called a kinetic chain, regional interdependence. They're all very similar ideas in the same family. So when a patient comes in, if they're talking about their shoulder and they're pointing at their shoulder, that's really one of the last places that I look. I mean, I can get them out of shoulder pain. That's not difficult. Manual therapy, soft tissue mobilization, kinesiotaping, even modalities are effective for some people. Getting them out of pain is not the problem. We want to fix the underlying problem. We want to fix the reason that that shoulder, that knee, that neck have become problematic in the first place. One thing I usually don't find is that people don't go from healthy to injured just like that. There's usually a breakdown over time, and that breakdown is usually the cause of a couple other things in the chain not doing their job appropriately. So one of the things that I do is I'll have people say, well, it's my shoulder, it's my knee, and they can get a little irritated when they see me not working on their knee and not looking at their shoulder right away. I'll get to it eventually, but I'm not looking at it right away. So one of the things I always tell them is, I use the plumber and the floor example. And this is the example that I use, the metaphor that I use when talking about treating the body as a whole and why I'm looking at a couple of different things. So what is the plumber and the floor example or metaphor? What's it all about? Essentially, what I tell them is when you come home, if you have water on your kitchen floor, that water is alerting you to a problem. So you mop up the floor, you mop up the water on the floor. Think of the water as the pain in your shoulder, your neck, your knee, wherever, it doesn't matter. Think of the water as that. You come home the next day, there's water on your floor again, you still have to mop it up, we still have to take care of your knee and shoulder pain, but we better start looking around for what's causing the water to be there. It's been there 2 days in a row now. Is it just happenstance? Is there a leaking pipe under the sink? Do you have a leaking ceiling right above it? Is the water being left on? The kids are being careless around the sink. What's causing the water to be on the floor? You have to do a little bit of investigation. That's where we come in. You have to do a little bit of diagnosis. So you see that, hey, there's a pipe leaking under the sink. You call a plumber. If you can't take care of it yourself, you call a plumber. The plumber comes over and they fix the pipe under the sink or anything else that's damaged that is a plumbing issue that they have to take care of. If you hired a plumber and they came over and mopped your floor and handed you a bill, you'd be very unhappy. So that's the analogy I use with my patients. When I'm looking at your ankle, your hip, your knee, your shoulder, whatever, I'm going to look at everything else in the chain that may be influencing what's causing that shoulder or that knee to work inappropriately, hence start to become painful. I mean, if you're playing rec softball and you take a softball to the knee and it's swollen up, okay, you have a blunt trauma that you can, okay, we have knee pain because of that, no problem. Go home, take care of it, rest it, elevate it, compress it, what you have to do on that front. But if it's just sort of an insidious onset or building up over time, then we have to look everywhere else in the chain. And I always tell them, the water on the floor alerts you to the problem. You wouldn't hire a plumber to mop your floor. You're not hiring a PT to just look at your shoulder. If your shoulder is problematic, I want to know what's causing that shoulder to do too much work. Is it that the thoracic spine, and that's the area of the spine where the ribs attach to, is that not moving appropriately? Because if that's not moving appropriately, then the way the shoulder blade, the scapula glides on those ribs is going to be dysfunctional, potentially leading to a few problems down up the chain. If your hip, especially your contralateral or opposite side hip, so if it's your right shoulder, we're talking about your left hip, if that hip is not rotating well, especially internally, meaning the femur or the thigh bone is turning in, if that's not happening appropriately, then every time you push, pull, throw, or especially throwing, you're going to try to gain too much effort from that shoulder, from the wrist, from the elbow, from the hand. That's going to be doing a lot more work because the hip isn't doing its job in transferring energy from the floor. Speaking of from the floor, if your ankle isn't doing what it's supposed to be doing, if the musculature around your hip isn't protecting your knee and there's a bleed in the force transfer from the floor all the way up through the shoulder and out to the hand, then you're going to start to develop problems in the shoulder. Most of the problems that happen at the shoulder happen below the level of the sternum, so right about here all the way down. Most of the problems in the shoulder have a contribution from something below the sternum level. That's why I'm looking at those things when you come in with shoulder pain. So again, you're pointing at your shoulder. It hurts when I do this. It hurts when I do that. It hurts whatever. I'm going to take a look at everything else in the chain because I'm the plumber and you don't hire me to mop your floor. You hire me to figure out what's going on and what the problem is. That's the analogy I use, and that seems to really stick for a lot of my patients. That seems to really make people understand that, okay, this guy here is taking a look at the entirety of the problem. Yes, he's going to get to the shoulder. He's going to make the shoulder feel better. And again, I can use repeated movements, extremities, McKenzie stuff. I can use manual therapy. I can kinesiotape it, heat, ice. There's a lot of things I can do to get rid of the symptoms, which is the pain. But I want to make sure that the pain doesn't keep coming back. I want to make sure that the body doesn't keep breaking that area down and making it work too hard. So I found that to be a very powerful example and a very powerful metaphor that my patients seem to really understand and really get. Another big cornerstone of what I do from the medical PT side of things is I don't see people very often. I don't see people twice a week for 8 weeks just because Independent Health authorized 16 visits. Of course, I had to get a little shot in there on that. But I tend to see people once, and then 2 weeks later, I see them again. I let them chew on what I gave them for 2 weeks, and then maybe 2 weeks after that, I'll see them again. But it's usually only 3 to 4 visits within the first 6 to 8 weeks. I'm not seeing people very often. And that's one of the advantages of the things I do. People get kind of sticker shocked by the cash-based therapy stuff, and then I break down that, hey, I'm not going to see you as often as some of these other clinics in the area who are trying to see you twice a week. Then they understand, they do the math, they figure it out, and they're like, okay, this is something that I have to be doing. What does that mean? That really means that I'm not using these to make them better. If they're only getting better because of these, then we have a problem. That's not sustainable for the patient. That's something better suited for a massage therapist or a chiropractor or someone like that who tends to see people for the medical treatment, because I do consider good massage therapy to be medical. They tend to see them every month for a little tune-up per se, chiropractor for an adjustment every month or every couple weeks. Those things are fine if the patient really feels that they need that and they respond well to it. But when I see people with that little frequency throughout the first 2 months, where it really is, you see them for about a month or two at most anyhow, then what really has to happen is they have to own their physical therapy. They have to own their treatment. I look at it just like with dentists. A dentist and hygienist will look in your mouth maybe once every 6 to 12 months, but you have to take care of your teeth the rest of the time. You have to brush and floss and mouthwash twice a day. You have to take care of all that. 2 by 2 is the little jingle they use, 2 minutes twice a day. And I talked in a different podcast about how I wish we had something like that in PT, where we had a jingle or something to really focus on musculoskeletal hygiene. I'll post that video link at the end here. But the idea being that if I'm not seeing you very often and I'm not making you better with these, then you have to make yourself better. So the analogy that I use for that is a boat. I'm sitting on the back of a boat. It's a rowboat. It's got a rudder, okay? And all I'm doing as the PT is I'm moving the rudder back and forth. That's it. The boat doesn't go anywhere if nobody is paddling, and that is you. That is the patient. If you're not doing your home exercise, if you're not doing your lifestyle modifications, if you're not taking care of all the yellow flags, which are sort of your psychosocial flags, anxieties, and living situations, stuff like that, if you're not taking care of all those things, then the boat's not going to go anywhere. I'm just moving the rudder back and forth. I steer the ship. You have to get yourself better. I'm just going to give you the tools and give you the direction to do so. So when I tell people I want them to do a repeated movement, 10 repetitions every other hour, whatever it is, then they have to do it or they don't get better. I don't make them better. I don't just manipulate and, hey, you're all better, it's all fixed. It doesn't work that way. At least not with my medical physical therapy, it doesn't. So I put the onus right onto the patient with that metaphor, and they understand it. They tend to get, oh, okay, you're not going to make me better. You're going to illuminate the pathway for me to do it. And if I don't do it, then I don't get better. So it's really a powerful tool, that metaphor right there with the person on the boat. Again, I'm just manning the rudder. You're the one that has to paddle. And if you're not paddling, the boat doesn't go anywhere. So if you're only getting better because I do a manipulation to your upper cervical spine, that's not going to be good enough. Especially if I see you once every 2 weeks. There's 168 hours in a week. If I see you for roughly an hour, that gives you 167 hours in the rest of the week that you have to take care of it. You have to do something. You have to maintain that therapeutic window that I've opened up for you, whether it's soft tissue work, manipulation, or whatever. And that's why my home exercise program has to be really on point. And that's why I only give people maybe 2-3 things for home exercise program. I don't want them to do a lot. I want them to be able to row at an acceptable pace. If they can't row because I've given them too many exercises, then the boat's not going to go anywhere. And these are the analogies that I give them. I use the plumber and the floor example all the time, and I use the rowboat example all the time with the rudder on the back. It's really 2 powerful analogies, and really as a patient, if you're listening to this and you're a layperson, then what I really want you to take away from this is that the entire body is involved in your symptoms. Your chief complaint, whatever it is, especially if it's simply pain or dysfunction, then the entire body is involved. Let the therapist look around at the entire body. Don't just focus on the knee because it hurts, or the shoulder because it hurts, or the jaw because it hurts. Let the therapist do the entire job. I mean, every place in the body is influenced by pretty much everywhere else in the body to some degree. If I can make that connection, then I'm going to show you that, hey, this now is moving better, it's hurting less after I did something somewhere else in the chain, and then people will buy into that a lot more. So let the therapist do their job and look at the entirety of, again, you don't hire the plumber to mop your floor. On top of that, understand that you are the most important part of all of your medical care. It doesn't matter if it's physical therapy, physicians, surgeons, it doesn't matter. You are the biggest part of your medical care. If you do not buy into what your practitioner is doing, if you do not understand what your practitioner is doing, if you are not compliant with taking the prescriptions that any practitioner gives you, whether it's pharmaceuticals or home exercise, they're both medical prescriptions. If you're not doing what you need to do, then again, the therapist can't help you, and it's really sabotaging what they do. So again, your therapist, your physician, whoever is just manning the rudder. You have to row the boat. Even if you go and have surgery, if you have orthopedic surgery, the surgeon and the PTs and the PAs that are working with the ortho, they're holding the rudder. If you're not doing your home exercise, you're not doing everything you need to do after the surgery, you're not going to get better. And you're not going to function the way you should be functioning after a total knee or a total hip or a total shoulder replacement. So you are the biggest part of your health care. You are the biggest part of your prognosis in terms of getting better from an orthopedic standpoint. So again, the two analogies, plumber on the floor, and then the therapist is just guiding the ship. You have to do the rowing. So I want you to take those to heart. If you're a therapist and you want to use those, have at it. Or if you want to use some derivative of that, that's fine. If you have your own that you really like, hit the comments section. Let me know what has worked really well for you in terms of patient care, the metaphors that you like to use. There's thousands of them out there. We all use them to some degree. What are the ones that you like the most? Hit me up in that comment section. If you're a patient, has there been something that a therapist has said to you metaphorically that has made you really have a light bulb moment and understand, oh, this is what they're doing, or why we're doing this, or why I have to do this going home? So that's what we got on the podcast today. It's a little lighter topic. I'm not beating up on the PT profession today. It took a little jab here and there, but nothing crazy. So if you liked what you heard, you know what to do. Hit that like, hit that share, hit that subscribe. The best things you can ever do for me is like it and share it. Sharing it is the big one. If you share this, you put it on your LinkedIn, you put it on your Facebook, you share it on your Instagram story or whatever, that is the biggest thing you can do for me in this podcast to really help it grow and reach more people and really get out there so I can get this message out to everybody out there. All right, this is the Dr. Kroll PT and Fitness Podcast. I hope you enjoyed it today. You know what to do. Hit that like, share, subscribe. I'll post a link to the musculoskeletal hygiene that I talked about when I was talking about dentistry earlier in the podcast. Enjoy your time. Thanks for spending the time with me, and I will see you next time.